Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then streptococcal species, right? The streptococcal species group A hemolytic streptococci, group A beta hemolytic streptococci is also important in impetigo. Impetigo is a pyoderma. Okay, it is seen in children who have poor hygiene and who live in warm climate. This impetigo is more common. In impetigo, the child will have pustular lesions are seen. These pustular lesions will become honeycomb like crusts are seen, but there is no fever, and it is these honeycomb like crusts or pustular lesions are painless in the child. So this impetigo, in most of the cases, it is associated with higher M types, and nephritogenic stains can cause impetigo in children. This impetigo can be of two types. We have bullous impetigo and non-bullous impetigo. Bullous impetigo is associated with lymphadenopathy, whereas non-bullous impetigo is not associated with lymphadenopathy. So we will learn more about it in dermatology.
thank you and thank you for watching.